Everyone, I'm Marianne Leary. I am the Director of Innovation here at Penn Nursing, and I'd like to briefly talk to you about our Penn Nursing Innovation Program and how you could get involved. So first, I just want to define innovation. So at Penn Nursing, we define innovation as the application of something new or different that delivers value. And we're not just talking about technologies or widgets, though that can be part of it, but really it's the systems and processes we create, the methodologies that we use, and the way that we communicate with our patients, their families, our colleagues, and really the community at large. And it really does involve a methodological approach infused with creativity and risk-taking. And hopefully you'll see that in some of the work that we're doing here at Penn Nursing as well. These are the different topics I'm going to briefly touch on, and hopefully some of these will spark your interest, and hopefully you'll want to get involved and work with us on our innovation programs. So first, I'll just talk about our Innovation in Health Foundations of Design Thinking class. And this is open to our undergrad nursing students as a case study, and also our upper level undergrad and graduate students across Penn's campus as an elective. It is an active classroom, flipped classroom approach where you are working through a real health or healthcare problem over the semester, and all of the traditional learning happens prior to class. So all of the reading, lecturing, etc. happens before you come to class, and then in class you're focusing on activities to help you design and solve for a problem. You're working in interdisciplinary teams of students from across Penn's campus. We really do try and make this a nice interdisciplinary mix of not just nursing students, but also Penn Medicine, Penn Vet, Public Health, School of Arts and Sciences, and of course, a lot of engineering, design, architecture students as well. The semester runs in over 14 weeks, and every 2 weeks you're focusing on one of the 5 stages of the design thinking process. And this class is offered in the fall and the spring. And this is what it looks like when we're in person. A lot of art supplies, a lot of things that you're up and actively trying to create solutions to problems, thinking about things in a different way, and really just getting creative. Students really like this class. My favorite comment has always been this one. It's the most fun I've had in a class since kindergarten. So hopefully you'll consider taking this class, and it will spark some innovation and creativity in the work that you're doing as well. Next, I just want to mention our Design Thinking for Health platform. This is a free open access curriculum that we created with the help of the Reed and Alex Hillman Foundation, so that nurses, no matter their experience, setting, or location, could really start to design solutions for problems they're seeing in their practice. This platform we use in the Innovation in Health course, and it's also, again, open to any nurse around the globe who wants to use it. It focuses on the 5 stages of design thinking, which is a human-centered approach to innovation. The online platform follows the same 5 steps of design thinking and includes 4 documentary videos of nurse innovators from around the country to help spark enthusiasm about nursing innovation, 6 lecture videos from nursing and design experts, and 10 podcast interviews, along with a number of design thinking resources and activities that are used in the design course I mentioned a little while ago. The course is set up so that you can read, watch, and listen, and then do the activities asynchronously. And I'd just like to give a shout out to all the people who participated in helping to put this platform together. These are 4 nurse innovators who are highlighted in our case study videos. These are nursing and design experts, and these are the nurses and innovators we interviewed for the podcast. So you can check all that out at the Design Thinking for Health site, which is designthinkingforhealth.org. And we really made this platform so that clinicians and educators anywhere, no matter their background or experience, could really learn this platform. And so we just offer this to anybody in healthcare or in education who wants to take components of it and infuse it into an existing class or workshop, or create a whole new workshop around it. And we just created 2 new videos where you can learn more, and here are the links to those. So hopefully you'll check that out. We are always looking for help promoting this platform, creating new content. So if that's of interest to you, please let me know. Next, I'd like to talk about our Penn Nursing Innovation Accelerator. So this accelerator is developed so that faculty and staff can create and test early stage solutions to improve health and healthcare outcomes. An accelerator program really includes 3 things. It includes funding, it includes mentorship, and includes educational opportunities. And that's what we're doing with our Innovation Accelerator here at Penn Nursing. You have a chance to win up to $10,000 for research and development of a proposed innovation idea that has an existing prototype that at least has been minimally tested. And if you're not sure what that means, I'm happy to talk you through that. We also provide mentorship and coaching from both the Penn and Philadelphia innovation and entrepreneurship ecosystem, and also educational opportunities. So this accelerator was really set up to provide education to those who are applying and who may have never applied for anything like this before. We really set this up so that we can help you learn this process and take those skills and resources and apply to other programs as well. If you're interested in applying, the deadline is soon. It closes October 31st. It's a 3-round process that runs over the next couple of months with a final pitch event in January. So if you're interested, please go to our innovation website, pennnursing.upenn.edu/innovation, and check out our Innovation Accelerator. And these are just some images from last January's final pitch event. And you can see we had one of our Penn Nursing students present, as well as faculty member and faculty and clinician colleagues from Penn Medicine. All 3 of those pitched at the final pitch event. We had a keynote speaker, Dr. Bonnie Clipper, who was the VP for Innovation at the American Nurses Association and is now the Chief Clinical Officer at WAMBI. And again, judges and mentors from the Philadelphia Innovation and Entrepreneurship ecosystem. And those are our winners. And they will now go through a 10-month-long Innovation Accelerator program. So if you're interested, again, please check it out. And if you have any questions, I'm always happy to answer them. Next up, I'd just like to mention our Twitter chat. We do Twitter chats every quarter on different innovation topics. We launched it with a specific topic on innovation in nursing, and then have done other ones on topics such as design thinking, hackathons, creativity, storytelling, and nurse-led podcasting. Our next Twitter chat is going to be on nursing entrepreneurship, and hopefully that's going to take place in the next couple months. We always invite experts in these areas from around the world to participate and answer questions. And of course, because it's Twitter, it's always open to the public. You can follow along at Penn Nursing Innovation. Our next topic is Story Slam. So a Story Slam is a storytelling event where storytellers get up and tell their real, true life story around a certain theme. We've had 2 Story Slam events so far, one in 2019 with the theme of innovation, and one this past February with the theme of courage. We are having our next Nursing Story Slam February 17th, 2021. That will be held virtually because of COVID. And this year's theme is stepping up. So as we all know, this is the year of the nurse and midwife, and it's like nothing we could have ever imagined. And so we're focusing on stories where nurses were involved with the fight for racial justice and health equity around the coronavirus, et cetera, and how nurses have been stepping up at the bedside, in schools, out in the streets, in the research and innovation labs to make the world a better, safer place for all. So if you're interested in sharing a story, please consider applying. The deadline is December 1st. And again, you can go to our innovation website and you can apply there. We are always looking for more student nurse storytellers and others to get involved in the Story Slam event. And don't worry if you've never participated in anything like this before. As part of this program, we are working with First Person Arts, which is a storytelling nonprofit in Philadelphia. And we will do a 4-hour virtual storytelling workshop where they will help you craft your story and your storytelling performance. Some of you may have heard we had launched the Amplify Nursing podcast earlier last year, and we finished season 1 in July, and we just launched season 2 this October. And we have guests who are leading the way in science, policy, innovation, research, and practice. And we talk with them about topics that are relevant to these areas and current events as well. So we did a number of stories around the coronavirus also. If you're interested in learning more about podcasting, getting involved in some way, we would love to work with students as well on this podcast. And so you can check us out on our Penn Nursing website. You can also download and listen to Amplify Nursing on any number of places, including iTunes, Spotify, Google Play, Stitcher, iHeartRadio, or wherever you do your podcast listening. We launched season 2 just a few weeks ago, and with Travis Nelson and also Senator Maria Collette. So we really are trying to make our episodes relevant to what's going on in the world. And as you all know, we have an election that is coming up. Finally, I'll just mention we do Penn Nursing Innovation Colloquiums a couple times a semester. We have one coming up November 11th, Becoming a Nurse Media Influencer, with Dr. Antiqua Smart, Barbara Glickstein, and Nicole Riccoboni. If you're interested in that topic, you can register for this free virtual panel discussion, again, on our website or through this link. And Barbara Glickstein and I co-authored an article on nurses as media influencers, which led to this panel, and you can read that here. And there's also an associated Twitter primer that I wrote more than a few months ago that you can check out also. But those 2 articles were the led into this panel that's coming up. Finally, if you are interested in the work we're doing here at Penn Nursing around innovation, please make sure you're getting our innovation emails. That will really keep you up to date on all of the things that we're doing, all the funding that is available, not just here at Penn Nursing, but really throughout Penn, throughout Philadelphia, and throughout the nursing, innovation, and entrepreneurship world. I really do try and list as many resources and opportunities as I am aware of, so that you can know what's going on in the nursing innovation space. With that, if you have any questions, please feel free to reach out to me. Like I said, we really do want to get nursing students involved in the innovation work we're doing. I'm always happy to hear your ideas. And if you're interested in any of the topics I discussed, please reach out. We'd love to work with you.